The access to qualitative health care is the right of every human being, right from conception to infancy, the formative years of the growing child, till adulthood. Good health care is paramount. The opposite is the case when the health care is not adequate, neither is it accessible nor even present at all. UNICEF, an international non-governmental organization which is into the safeguarding of health of children and mothers all around the world, is here in the Kosofe local government area of Lagos State to bring health succor to the doorsteps of the people.
Before, I normally go to Bakba, so there is a day I was passing here, I just saw them, I asked. They said whenever I want to give my baby immunization, I should come to this place.
It's church, so they told us that we should come here because we don't have any center here. That is why they say you should come here.
I was passing by and I saw them, so a woman called me and told me that if I want to give my baby immunization, I can come here anytime from 1 day to 5 years. And I came today to collect it for my baby.
This is also with the objective of reducing the number of unimmunized children by at least 30%. 80% of sick children with malaria, pneumonia, and diarrhea get treated. 90% of all pregnant women receive focused antenatal care, including HIV testing. 80% of babies are exclusively breastfed for at least 6 months, and 70% of all births are registered. The identification of the slums in the local government area of Kosofe, which are Mustafejo community, Olubori Odoifa community, and Idiaraba community, were selected by UNICEF because these areas lack a lot in the area of health, infrastructural, and social facilities. For the program, UNICEF, in collaboration with Kosofe local government, made available equipment, several vaccines, and other health-related items that were used throughout the outreach program. The community leaders at the various slums were mobilized to help in strategizing ways of sensitizing the people of the slums with the use of traditional means of communication, for example, the town crier, to mobilize the people about the health program and the benefits of participating in the health exercise. Technical problems, ignorance of mothers, and the nonchalant attitude of mothers about vital health details of their babies. Although all these problems did not deter the health workers from doing all that is expected of them during the exercise.
Most of the mothers too, so we have difficult ones among them. And the thing is that sometimes when they come to the clinic, you ask them what's their name. Some of them will say they don't know their husband's name. Their address, for them to give you the address, it will be very difficult for them. When the date of birth of their children, they don't know.
The health workers administered immunization vaccines, BCG, polio, vitamin C on the children. Pregnant mothers took tetanus injections and had blood pressure checkups. Proper birth registration, documentation, and issuance of birth certificates were done. Another major highlight of the health outreach program was the various trainings and workshops that were organized to enlighten parents on various health issues affecting the children, pregnant mothers, and how to be better health care providers. One of such was the Kosofe Health Workshop, where representatives of people of the slums were educated on health issues such as HIV and AIDS, danger signs in pregnancy, eating habits during pregnancy, and how to deliver babies. Drama remains an important tool of advocacy in any campaign. The introduction of theater for development by UNICEF in educating the rural folks in the health intervention also came to light at the Kosofe Health Outreach Program. The highlight of the program included speeches, drama presentations,
ọ̀rẹ́ mi mo lọ sí àwọn àbá ẹ̀ kújọ́ mẹ́ta ọ̀rẹ́ sórí gbàrà tárábìnrin bá ti ń bímọ báyìí tọ́mọ bá fi lè ní àǹfààní láti mọ ọmú àkọ́kọ́ tó jáde láti ara ìyá ẹ̀ ara ọmọ yóò le kọ́kọ́kọ́kọ́ ni kódà bọ́mọ bá ní àǹfààní àti dìde gbá àwọn tó gbẹ̀bí rẹ̀ létí yóò mọ fún wọn ní ṣíngólẹ̀ ọ̀kọ̀ọ̀kan àní kó má lọ sílé ìgbẹ̀bí o ṣùgbọ́n tó bá ti ń lọ báyìí tó bá ti fẹ́ yíwọ́ kó má lọ sílé ìwòsàn ìjọba láti lọ gba abẹ́rẹ́ àjẹsára kò jẹ́ bó ti jẹ́.
UNICEF also had a stakeholders meeting with all the representatives of the relevant bodies concerned with the intervention program.
And now from the Kosofe local government, we held this meeting in order to know the challenges the Kosofe encountered and how they are able to overcome those challenges, so that their expenses will now be used in the new local government.
Because we had the relevant stakeholders on ground, and each of them was able to tell us their progress report. The essence of the meeting is to review our implementation, and we've identified the challenges, and we were able to put to the table how we intend to overcome that challenge, and at the end of the day still get those children immunized.
The intervention program brought relief and the convenience of qualitative health care to the people.
Unlike this outreach, the health center takes time.
From the slum, many are appreciative of what UNICEF, in conjunction with Kosofe local government, has done.
UNICEF adúpẹ́ lọ́wọ́ wọn, iléeṣẹ́ wọn máa tẹ̀síwájú.
So it's up children.
She's now closer to us. Then we are happy. We are happy because those nurses, they do attend to us well.
I want this program to be continued.
So I prefer this place closer to my house, and it's okay.
I want them to continue with it because it's helping people that don't have transport to go. So it's helping people.
They really liked it because we have a lot of unimmunized children. We've seen a lot of unimmunized children.